Well, yes, it's been 2 years since COVID broke out, and we're wondering where are we in that mix right now. I was telling you about a joke that people have been making, and just behind the scenes, I've been told that it's not exactly a joke about how reporting on COVID-19, it would seem, has taken the backseat in the wake of the Ukraine or Russia-Ukraine war, or the invasion of Ukraine, however it is you choose to couch it. As there have been questions as to what exactly is happening with COVID. We know that a few countries have relaxed their rules. Where is Nigeria with its vaccine mandate? Have a lot of people taken on the vaccines, or has that also been relaxed? We have with us this morning Dr. Mukhtar Muhammed, who is the head of Technical Secretariat and member of the Presidential Steering Committee on COVID-19. You're welcome to the program, sir.
Good morning, Malte.
We also have joining us via Zoom Professor Oyewale Tomori, who is a professor of virology and past president, Nigeria Academy of Science. Prof, you're welcome to the program and good morning to you.
Morning, Mape. It's a pleasure seeing you again.
So perhaps I'll start with you, Prof. I do not know what your reading of the situation is with our fight against COVID-19. I know that the federal government did start a campaign only recently. We've been saying that they have been on the campaign for a while, but I think now there is a more vigorous one on television. I do not know if it's still running now. I know I've seen a few times if it's still off or if it's off now, encouraging people to go and get vaccinated. It's unclear how many people have taken on the vaccine, but how would you rate our fight against COVID-19? Is the fight still on in your estimation, or would you say that we've turned our attentions to all that types of fights currently bedeviling us?
Thank you very much. I think, unfortunately, as always, we always follow what others are doing. The world is relaxing all over the world about COVID and all that. But WHO keeps warning us that the problem is not over. A lot of the European countries, for economic reasons, are scaling back on all the plans they have, which I think is wrong. And I think we in Africa should not follow that. COVID is still around. The figures that came out of recent, over 2 million people, according to WHO yesterday, cities in China are under lockdown because they are like over 5,000-10,000 cases occurring in one day. So it's still around. The fact that we're not getting figures in Nigeria is because we have also abandoned the whole thing. Mukhtar knows that I've already sent him a note about that issue when I said the steering committee was now becoming a steering committee, just staring at what is going on and letting the people decide. We need to continue to let the people know that the problem is not over until it is over in the last country. I think one good example for us is to see what has happened with polio. Afghanistan and Pakistan had polio. Recently, Malawi got a case of wild polio, even though Africa has been declared free. So it's not over until every country is no more COVID in every other country.
But Prof, we've also heard, and this is something that's also coming from scientists who are saying that we might need to live with this. That it's going to be like almost every other disease which we'll need to live with. It's not going to be something that we can eradicate like polio or maybe smallpox. It might be something that will be like the flu, which you get, you treat, and then you go back to work. You don't agree with them?
No, I do. Eventually that's what it's going to turn out to be. We're going to find waves of whatever, endemic diseases coming up at time. When the population with the immunity goes down, then you have an upsurge in cases, which has happened with many of the diseases, especially with respiratory diseases like flu. So it becomes an annual thing, and variants will still keep coming out. You have a large number of people whose immunity will wane, and the population that is susceptible and vulnerable will increase with time, and therefore you get an upsurge. And that's what happens with endemic diseases. Yeah, so this is probably going to turn to be that we continue to need a vaccine. We continue to monitor what is happening. and our record that this surveillance must continue. Okay, that's the only way we can know whether we have upsurges or we don't have.
Okay, let me come to you, Dr. Mukhtar. I do not know, Prof said he already communicated with you that, your committee is now a looking committee. Is that the situation?
No, we joked about it with Prof, I really admire his sense of humor. He always makes you laugh, but in reality, the situation is that we're continuing to monitor the situation. A lot of things are happening in the background. We do not want to send conflicting signals without really knowing what the situation is and what the guidelines will be. As Prof mentioned, so many countries have relaxed their situation, mostly for political and economic reasons. And we don't want to follow suit. Many people that call, urge us to also relax our rules, remove restrictions, and so on and so forth, because they see when they travel outside, most of these countries have relaxed their rules. But what we're doing is we are following it cautiously. We're trying to monitor the situation, assess the risk of importation into our country, and be able to adjust our restrictions. We've always tried to allow pragmatism and science to lead us, not just what other countries are doing. That is something.
Restrictions, Dr. Mukhtar. I mean, as far as majority of, my producer just puts up those visuals. Life has gone back to normal for many Nigerians. They're going back to their places of worship. They're going back to their mosques, their churches, marketplaces. No one is wearing a mask anymore. And it would seem that the only places where you need a mask to enter are banks, government offices, and maybe some government functions where it is required that you must wear a mask. And even then, sometimes people just wear it as a gate pass. They wear it, and then when they're inside, the mask is down. So what regulations are we really talking about here?
So the regulations I was referring to are mostly the travel regulations, which require you to follow certain protocol, do your COVID test before you come. When you arrive, you do another COVID test. Some countries have waived that they don't require COVID test before you get into their country. And the reason is not far-fetched, because they have reached a certain critical level of vaccination. Therefore, a few trickles of people who are positive who come into these countries, will not largely increase their risk and vulnerability of their population. It's the concept of herd immunity. But even that now, we can see that with the current things that are happening, Russia, Ukraine, conflict and a lot of influx of people from Ukraine into Western Europe now, we see that the numbers are beginning to rise. Over the last 1 week, we've seen cases rising in those, because if you have a large number of people going in at a time, they can affect the situation in your country. But if it is small trickles, and you have achieved this critical level of vaccination, it will not. The same thing applies to us. We have always monitored the trend in Nigeria to even predict when the next wave, is going to be. And that usually coincides with the period of high volume of travel, particularly from Europe into Nigeria. For example, now we are trying to monitor from now to the Easter period. We know that is when we have a lot of people. And if something, currently we have the evacuation of Ukraine, mostly students into this country. And we've seen how that large number also, that came, how it has changed even the reporting, within NCDC. Out of the over 1,500 that came in, we have almost 13.5% of them testing positive. And this is because Ukraine itself has been a country where largely the COVID protocols are not really fully enforced. Their vaccination level is actually low. Even Russia itself, the vaccination level is not as high as in Western Europe. So these are the risks, and these are the determinants of the global spread.
But compared with where they're coming to, Nigeria, some people might argue that perhaps their vaccination, I mean, are we at par with their vaccination levels, or are we even lower?
Our vaccination level actually has been low. Right at this moment, we're talking about maybe 7-8 million people who have been fully vaccinated. The total doses administered also, is nothing comparable, to where we should be as a target in the country. But it is growing up. I mean, it is improving. But not really at the level that we would want it to be. We had wanted that by the end of first quarter of this year, we would have reached at least 50% of our target, but we're quite far from that. So, but it's not only vaccination. It is now the measures you mentioned that are in place. For some time in Nigeria, yes, the numbers have not been coming because, as Prof mentioned, our testing has not been really too elaborate. We've been over 70% of the testing we are doing is mostly among the travelers, people who are traveling, and therefore that is not telling us exactly, what is going on in the wider spectrum within the country. So we need to improve on the testing. We need to test people in the hospitals. That is the way we know that we're really dealing, with the actual figures, that we should be dealing with in the country. But again, all hope is not lost because we have not seen any rise, significant rise in the number of hospital admissions. So that is comforting us to tell us that even if people are getting infected, they're just getting the mild form of the disease. It does not lead to hospitalization, and also it does not lead to any increase, significant increase in the number of deaths.
Okay, let me bring in my colleague, Kayode, here.
Oh, thank you, Mark. Dr. Muhammed, so this is for you, still talking about traveling. This has been a major concern for a while for a lot of travelers in Nigeria. In fact, let me just accentuate this. Okay, can you hear me, Dr. Muhammed?
Sorry, Mark, I can't hear him.
Okay, we'll try to work on that, Dr. Muhammed. I just wanted to put this question through to you about, testing for vaccinated people who come into the country. But we'll work on your audio. But let me just bounce this off, Professor Tomori. It's been a major concern for a lot of people who travel into the country, and this is for Prof, by the way. So they compare this to having to travel to the UK, for example, especially fully vaccinated people who don't have to, go through some processes like the, pre-boarding test, 48 hours, the day 2 test. That's for fully vaccinated people. And I wonder why that's still the case in Nigeria. And I wonder for you as well, is that a big question mark for you?
Yeah, thank you very much, my friend. You see, I think we need to look at the whole spectrum. If somebody is fully vaccinated and is certified as fully vaccinated, I agree with what is going on in other parts of the world. There's no need for testing and all that on. And I think we can adapt, to that kind of situation. My worry, for example, what is happening, just like Mukhtar said, with the influx, with what is happening, relaxation in Europe and other things, possible new variants coming up, many more people will get infected even after the vaccination. And therefore, we need to continue on our own side to protect ourselves because we don't have the kind of vaccination we want. And many more people coming in a country that has relaxed its process. Just like, again, we've been told, the cases are rising over there. And I'm sure some of these are among some of the people who have been vaccinated. So I think on that point, we should still keep some of our regulations, to protect ourselves. If they're going over there and the country says you don't need to test, then I think we should stop that. I mean, the country says you can come to my country without your testing, you are fully vaccinated, then we shouldn't insist on testing people who are living. But for us, in our own country, because of our own level of vaccination, the fact that, the cases are now coming up in other places, I think we should still insist on testing whoever is coming to this country.
Let me take this back to Dr. Muhammad, Prof. I hope you can hear me now. And I'd like to know the science, the thinking behind that, still keeping that measure in place. And I've talked about traveling to the UK, for example. You don't need a PCR test, and you don't need the processes that follow. It's been totally lifted because the thinking is once you're fully vaccinated, you should be fully, at least to a large extent, over 90% protected from the virus. So why are we still keeping that here in Nigeria? You have to do 48 hours pre-boarding test and do day 2 tests for fully vaccinated people. And this mail from one of our viewers, Thompson Kumeni, actually speaks to that, saying that it actually costs 90,000 naira just to get the testing, when in other countries you don't have to go through all of that. So for him, this is confusing, and he's demanding an explanation for this. And I imagine for a lot of travelers, they also want to know what is the science behind it.
Okay, so let me take the issue separately. I think following on the science, if you look at why do you need to test before you come into the country, Prof has mentioned that we are largely unmitigated community. Largely our people have not been vaccinated, and therefore any shift in the, if you have large volume of cases coming into the country, it's really going to disrupt our epidemic. It is going to raise more cases, more hospitalizations, and probably more critical care. So we have not reached the stage where we will say that everyone coming into the country, you know, although we are considering it, but again, we need to monitor the situation and see what is going on in Europe now. We've had discussions, in fact, for the last 3-4 weeks, you know, about relaxing these aspects of, you know, the protocol. But we are, as I said earlier, we are treating with some caution, so that we don't start reversing ourselves when things and conditions change. So that is number one for people coming into the country. For people going out of the country, our rationale for having them to either show a vaccination card or to test. You remember that early December, you know, at the beginning of the Omicron variant proliferation over the world, many countries were very quick to list Nigeria or delist Nigeria and say that we are a red country, that we've been importing cases of Omicron. You know, you remember the famous cases in the UK, in Canada, in the UAE, you know, where they were quick to ban Nigerians from visiting those countries, even though we know, you know, what results are issued from here. But because we could not largely control some of the fake results or whatever, they just get 1 or 2 cases and then, boom, you know, they delist your country. So it was for that reason, because we not only want to protect Nigerians, we also want to protect Nigeria's image, that we insist that if you are not fully vaccinated, you have to do a PCR test, so that, and that PCR test has to be verified by NCDC, so that we are sure that, you know, you are not exporting COVID-19 to other countries, because other countries have not treated us the way we have treated them. For example, we do not deny any passenger from, you know, from other countries. You know, we have not really listed any country to say that people from these countries are not allowed into Nigeria since the Omicron period. So,
that point,
but other countries have done that, and we
I understand
that
the point.
what we should do is
right,
to really open up.
I understand that point. I mean, the thinking behind that. But this is for fully vaccinated travelers coming into Nigeria. I'm talking fully vaccinated, not unvaccinated or partially vaccinated. Fully vaccinated Nigerians or travelers coming into Nigeria. Why do they still have to take a test and still do day 2 test when they come into Nigeria? I mean, costs 90,000 or even more. What's the thinking? That's been largely, you know, taken out of the way in other countries.
So even if you are, so here's the science. Even if you are, I don't know if you can hear me.
Yes, please go ahead.
But even if you are fully vaccinated, it does not mean that you are protected from getting the virus, that you cannot get infected. The only thing is that if you are fully vaccinated, you can get infected, but the virus will not have any untoward effect on you. You are not likely to get sick, you are not likely to get hospitalized, and you are not likely, to die from the disease. But even if you are vaccinated, you can still transmit the disease, although not in the same capacity and volume as people who are unvaccinated. So Nigeria being a largely unvaccinated community, you have someone who is vaccinated who will not get sick, and he comes into the country, he is welcomed into the family that is not vaccinated. The tendency is that the people in that family are likely to get infected from him, and they will fall sick, not him, but they will fall sick. So if you have people with comorbidities or people who are more vulnerable, they can be hospitalized and they can die from it. So that is why, even if you are vaccinated, that is largely what led to our thinking that you have to take the test. But, as the vaccination coverage continues to improve in our country and also in other countries, so we have to look at it both ways. If Europe today is largely vaccinated, it means that the transmission within that community, will be low. And therefore, the tendency for them to be positive when they arrive in Nigeria will also be low. And that has really impacted, what we are seeing now. Because largely most of those countries were vaccinated just before the Ukrainian crisis. The numbers came down very well. Even the travel between UK and Nigeria, you find many people testing negative, largely, on their day 2 test. So, that's why we will not, we have to be cautious, we have to protect our people. We are aware of the size, we are also aware of the constraint, we are aware of, people wanting to travel very freely, and like I told you, we are really considering this removal of some of these restrictions. For example, the pre-boarding test, we can now replace it with testing on arrival. It will make it easier. We have done the assessments of the airports, to try to put that in place. So it's something that we are really concerned about. And the cost, yes, we're also trying to bring down the cost to replace the current PCR testing with what is called a rapid PCR testing, or even the rapid antigen testing for testing on arrival, so that we can ease, the burden. There are so many ways that you can mitigate the risk. In the past, we did not know much about the disease, and that is why we had this caution. Even though, Nigeria's restrictions have not been it's not really one of the strongest. We've always relaxed and we've always tried to open up, the travel and economies. But it's something that we are working on, and very soon, Nigerians will hear of the changes in our protocol.
Doctor, that you are at least aware of all of these issues, and you mentioned the costs of the vaccination and all of that, because that's one of the issues that a number of people have had about it. It's not just the payment, it's the commercialization of the process. And I'm sure, as you said, you are aware of that as well. What has been done or is being done to curtail that? And is there a punitive measure for those medical facilities that commercialize the process to the detriment of the intention for which the process was set up?
Yeah, so again, at the beginning, really what informed our choice of having 2 tiers, to have the public sector testing and to also have the private sector testing, is because we didn't want to have a mix. If you recall, very early on, the government expended a lot of resources to build the public health laboratories, to institute PCR testing, such that we virtually have these laboratories in almost all the states in the country. However, for private testing, we preferred to go with private because it is something that needs to be paid. Government cannot sustain, the huge resources that are required to procure these testing machines and the consumables and the rest. And therefore, if we do that, we know that, it's government that is going to bear the burden, because it's going to be free. So we did a 2-tier approach. Those who need the test, these are people in the communities who are exposed to people who have been positive or people who are at high risk of testing. This one's government will do it for free for them. And currently it is still going on. The only thing is that our health facilities or these laboratories in public institutions have not been testing as much as they should. The second tier was the private sector initiative for testing. And this is strictly for travelers. For travelers and then people who do not want to attend government hospitals to get tested. So if you are traveling, government cannot provide the test kits for you, the consumables and all of that, because it's really expensive. At the beginning, how much were we spending to set up laboratories? It was a huge amount of money. And therefore, that's why we have these two tiers. The private sector to test people who want a test, and the public sector to test for free people who need that test. And with time now, with improvement in technology, we have seen that even the cost of test now can come down if you're doing, for example, a rapid antigen testing compared to a PCR test. So it was all considered. And you know, if you compare also our test, the cost of testing in Nigeria with the cost of testing in many other countries, you realize that really the Nigerian test is not expensive. People who have gone to UK will tell you how much they have spent to get a PCR done. And
I guess the point for a lot of Nigerians is that they've stopped paying those tests. They've stopped paying for those tests in the UK. They don't even need to quarantine anymore. So, of course, when it's happening in places where, as you rightly said, vaccination level is high and they are vaccinated, they wonder what is happening back home where, you know, people are it's not like I see people are dying in their numbers as a result of COVID. You know, they're wondering why it is that they now have to test when they now come back home and they're already double vaxxed anyway. So I think that, you know, perhaps a review will continue in the Presidential Steering Committee and maybe a decision will finally be reached as to, you know, what the next step ought to be, or perhaps another briefing of Nigerians as to why this is important and necessary. But in the meantime, we have to thank you for coming on this morning. We have been speaking with two gentlemen. Professor Oyewale Tomori is a professor of virology. He's been speaking with us via Zoom. Yeah, and a past president, Nigerian Academy of Sciences, has been speaking to us via Zoom from Ibadan. Prof, thank you so much for your time this morning.
My pleasure.
And we also had here in our studios Dr. Mukhtar Muhammed, who is the head of Technical Secretariat and member Presidential Steering Committee on COVID-19. The committee's mandate is still on?
it is still on.
When will it be over?
Well, you know, as long as there is need for the committee to continue, certainly the committee's work will continue. But we are also, you know, trying to get to the end of this, hoping that there is not going to be another wave in March, April.
Well, it's our hope as well. Thank you so much for coming on Sunrise Daily this morning.